So today we are going to continue our discussion, which is the exercise number 9, the muscular system. So the muscular system is concerned with the various type of movement. It is composed of muscle which differ in origin, histology, distribution, and function. So in other definition, muscular system is an organ system consisting of skeletal smooth and cardiac muscle. It permits movement of the body and cardiac muscle. Cardiac muscle. It permits movement of the body, maintains postures, and circulates blood throughout the body. The muscular system is vertebrates are contoured through the nervous system, although some muscles can be completely autonomous. So the muscular system is an organ system that consisting of skeletal, smooth, and cardiac muscle. So next is the skeletal muscle cells are cylindrical and are attached to fibers from end to end. Several of these fibers are bound together into bundle. So next is muscular of the head ventral aspect. So muscular on the head ventral aspect include the tongue, the muscle of facial expression, extraocular muscles, and muscles of mastication. So ang musculars of the head is na-include niya ang ato ang tongue. And the tongue is comprises of intrinsic and extrinsic muscles. It receives motor innervations from the hypoglossal nerve. Sensation of the tongue can be divided into taste and general sensation. So next is the myloid, a very thin sheet of muscles at the ventral surface of the head region, the muscle fibers of which run from the median ruff to the lower jaw. So the myloid is one of the muscle essential in performing the functions of the swallowing and speaking. So ang myloid this is very important in our body because this is the one organ or the one muscles that the function of swallowing and speaking. So siya ang usa ka muscles nga gatabang nato sa ato ang pagtulon o sa atong pag-istorya. So next is the muscle of the head. So the muscle of the head is, in my research, the muscle of the head include the tongue, muscle of facial expression, extraocular muscles, and muscles of mastification. So the tongue comprises of striatic and striatic muscles. It receives motor innervation. So next is depressor mandibulae. So depressor mandibulae is a broad muscles behind the tympanic ring. So in other definition, it is the M. depressor mandibulae is perhaps the most noteworthy of the muscle invertebrate by the facial nerve because of its obvious function in controlling jaw opening. So siya ang gakontrol sa ato ang jaw opening. Ang gakontrol is ang depressor mandibulae. Next is the temporalis. The temporalis is a small muscle that extends from the tip of suprascapula to the region between the lymphatic ring and the eye. So ang temporalis what is temporalis? So temporalis is a thin, fan-shaped muscle situated with the temporal fosses of the skull. So ano siya example of temporalis kana mo na siya example sa temporalis. Next is along with the medial thyroid, lateral thyroid, and master muscles, It belongs to the group of mastificatory muscles. It belongs to the group temporalis muscle runs superficially from the temporal bone and to the coronoid process of mandible. So next is the masseter. So masseter is one of the muscle of mastication. Mastication, a powerful superficial quadrangular muscle originating from the zygomatic arc and insert along the angle and lateral surface of the mandibular ramus. The masseter is the primarily responsible for the elevation of the mandible and some protraction of the mandible. So next is the abdominal muscle. So what is abdominal muscle? So abdominal muscle is support to the trunk, allow movement and hold organs in place by regulating international abdominal pressure. So abdominal muscle is gaalo siya sa movement sa pag-hold sa mga organs in our body. So the deep abdominal muscles together with the muscle in the back. So ang muscle sa atong likod is nabilong ko siya sa abdominal. So make up your core muscles in the back and help keep your body stable and balanced. So ang abdominal muscles is siya pud ang tabang para sa pagbalance sa ato ang lawas and protects your spine. Siya pud ang ga-protect sa ato ang spine sa lawas. Next is rectus abdominis. So in your understanding, what is rectus abdominis? So, a rectus abdominis is slung between the ribs and the pubic bone at the front of the pelvis. So, sa atubangan sa atong pelvis, sa tunga sa ribs and the pubic, dito na to makitaan ang rectus abdominis. Rectus abdominis na siya sa center of the ribs and the pubic. When contracting these muscles, has the characteristic bumps of bulges that are commonly called the six-pack. The main function of the rectus abdominis is to move the body between the rib cage and the pelvis. So ang function aning rectus abdominis is usa siya ka muscles nga nagtabang siya nga ma-move ang atong lawas sa between sa atong rib and sa ato ang pelvis. Now, next is the external oblique. So, the external oblique is the muscles, one of the outermost abdominal muscles, extending from the lower half to the ribs around and down to the pelvis. So, from the lower half of the ribs, nagdikuan siya ni down to the pelvis. Next is internal oblique. So, ganina is external, so now is internal. So, internal oblique is internal abdominal oblique is a muscle found on the lateral side of the abdomen. So, it is a broad and thin. It forms one of the layer of the lateral abdominal wall along with internal oblique on the outer side of the transverse. And then, the transverse abdomens on the inner side, its fibers are obliquely oriented, hence the name. So the next is the thoracic or chest muscles. So what do you mean by thoracic or the chest muscles? So thoracic or the chest muscles is made up of 5 muscles. So the 5 muscles that's made of thoracic is the external intercostal muscles, the internal intercostal muscles, the subcostals, and the transverse thoracics. These muscles are primarily responsible for changing the volume of the thoracic cavity during respiration. The next is the deltoid. So deltoid is muscles are in your shoulder. So ang deltoid makita nato ni siya diri sa ato ang shoulder. Shoulder which is the ball and socket joint that connects your arm to the trunk of your body. Deltoid muscles help you to move your arms. So kaning deltoid muscles is muna siya usa nga gatabang para makalihok ang atoang arms. And then they also protect and stabilize your shoulder joints. Siya pud ang ga-protect sa atoang mga joint diri sa atoang shoulder, diri sa atoang baga. Like most other muscles in your body, the deltoids are skeletal muscles. So, ang deltoids diay is a skeletal muscles. Next is the sternurodiales. Sternurodiales is contribute significantly to muscular response in a plexus, and the tectonic fibers in these muscles play an important role in plexus. Next is pectoralis. So pectoralis is the major, superior, most, and largest muscle of the anterior chest wall. So ang kaning pectoralis is makita nato ni diya sa ato ang dughan. Next is anterior pectoralis. So kung naay pectoralis is napod siya anterior pectoralis. So anterior pectoralis is the superior, most, and largest muscle of the anterior. Next is middle pectoralis. So the middle pectoralis is a major action for adduction or depression of the arm to the action of the deltoideus muscle and rotation of the arm forward about the axis of the body. Next is posterior pectoralis. Kung naay middle pectoralis, anterior pectoralis, naapo na siya posterior pectoralis. So, ang posterior pectoralis is the arm forward. When the raised arms are flexed, it assists the latissimus dorsi teres major muscles in pulling the trunk up. Next is the muscle of the back and girdles or dorsal aspect. So, muscle of the back means providing structural support to your shoulder region on the left and right side of your body. They also allow for a large range of motion, connecting muscles necessary for shoulder and arm movement. The pectoral girdles on either side of your body are not joined together. Next is latissimus dorsi. So what do you mean by latissimus dorsi? So latissimus dorsi is a broad, flat muscles that occupies the majority of the lower posterior thorax. The muscle's primary function is the upper extremity but is also considered to be a respiratory accessory muscles. Next is the dorsalis scapulae. So, what is dorsalis scapulae? So, dorsalis scapulae is innervate the rhomboid muscles which pull the medial edge of the scapula upward and toward the midline. So, next is the longissimus dorsi. Longissimus dorsi is the longest, thickest, and most central erector spina muscles. So, siya ni ang pinaka-longest nga muscles. It is divided into 3 parts. So, divided into capitis, cervicis, and thoracis. So, based on their superior attachment and location, the erector spinae muscles, including longissimus, are the most powerful extensors of the vertebral column. So, ang kaning longissimus, it is one of the very longest or thickest and the very powerful vertebral column in our muscles or in our bone. Next is coccygeolacus. So, what do you mean by coccygeolacus? So, coccygeolacus is known as the triangular shape sheath of muscle located posterior to the levator ani muscles in the pelvic floor. So, next is the muscle of the thigh. So, muscle of the thigh is to bend and flex, rotate. They also bear most of the body weight. The thigh muscles allow the lower body to bend, flex, and rotate. So, kaning muscle is muscle tie is nag-allow ni siya sa atuang lower body to bend or flex and rotate. They also bear most of their body's weight and keep the hips and legs aligned. So, siya pud ang gapa-align or siya pud ang gapa-tadlong sa atuang legs and atuang hips. In addition to providing and assisting with balance. So, next is vastus externus. So, what do you mean by vastus externus? So, vastus externus is the most, also called the vastus externus, is the largest and most powerful part of the quadriceps femoris, a muscle in the thigh. Together with other muscles of the quadriceps group, it serves to extend the knee joint, moving the lower leg forward. So next is adductor longus. So adductor longus is a large fan-shaped muscle located in the medial aspect of the thigh. It belongs to the adductors of the brevis, adductor magnus, and pequeños and gracilis muscles. Next is sartorius muscle. So sartorius is the longest muscle in the body. So kung nota na gani ang inyong mga classmates or inyong maestro og unsa ang longest muscle sa atuang lawas, so ang longest muscle in our body is the sartorius. The word sartorius is derived from the Latin word sartor, which translates to patcher or tailor, due to how the individual will position their leg while working. So next is adductor magnus. So adductor magnus is described as a large triangular muscles with a proximal tenuous attachment to the inferior ramus of the pubis, the ramus of the ischium, and the ischial tuberosity. Next is the gracile major. So, naay gracile major, naasab na siya gracile minor. So, naon na to ang gracile major. So, ang gracile major is assist with hip adduction, knee flexion, and knee internal rotation. So, kaning gracile major is naani siya sa atuang knee nga part nato makitaan. Next is the gracilis minor. So, gracilis minor is assist with hip adduction, knee flexion, and internal rotation. So, another one is semitendinosus. Semitendinosus is a muscle collectively with the other two muscles of the posterior compartment of the thigh. Works to extend it and the hip and flex at the knee. The semitendinous muscle in the particular has the added functionality of the assisting the popliteus muscle in rotating the leg internally. Next is the muscle of the shank. So, diri na ta, the muscle of the shank. So, what do you mean by the muscle of the shank? So, the muscle of the shank is muscles of this area are euchard. The major muscle of this area are calves or gastrocnemius and soleus. Tibialis anterior or surface muscle on the front of your shin, and tibialis on posterior. So next is gastrocnemius. So gastrocnemius is a complex muscle that is fundamentally involved in walking and posture. So kaning gastrocnemius is na-involve ni siya kung maglakaw ta is siya diri is involved ang gastrocnemius muscles. It affects the entire lower limb and the movement of the hip at the lumbar area. Next is tibialis procticus. So tibialis procticus is acts to plantar flex the foot and invert the foot and support the medial arc. The muscles of the anterior compartment primarily antagonize the posterior compartment muscle. So next is the extensor cruris. So what is extensor cruris? So extensor cruris is a short muscle found tightly attached to the upper 2/3 of the tibio-fibula. So it originates on the femur insert on the tibiofibula and extend the trunk. The tibialis anterior longus is a small muscle with two bellies that lies anterior to the tibiofibula. So next is the flexor tarsi anterior. So what do you mean by flexor tarsi anterior? So flexor tarsi anterior is the narrow muscle distal to the extensor cruris, anterior surface of the middle and distal half of the tibiofibula. Origin of flexor tarsi anterior, proximal end of the astragalus and fascia of the foot. So next is the thigh has three muscles. Compartments, anterior compartment, pit. Sartorius and quadriceps muscle or rector femoris, vactus lateralis, vactus intermedius, and vactus medialis. The femoral nerve and superficial femoral artery supply these muscles. Next is triceps extensor femoris. Bicep femoris is a muscle of the posterior compartment of the thigh and lies in the posterior lateral aspect. So the next is internal organs. So inside the body cavity of frog, there are many organ systems present such as the circulatory system, digestive system, and etc. So next is bicep femoris. Next is phyroformis. So phyroformis is a small slender, extending ventrally and posteriorly from the tip of the urostyle. So next is gluteus. So gluteus is a short muscle lying between the rectus femoris anticus and vastus. Next is tibialis anticus is a narrow muscle lying at the most anterior side of the fibula. Next is peroneus is lies immediately posterior to the tibialis anticus. So next is the gastrocnemius is already described and identified earlier. So that's all for exercise number 9. So thank you.